Hello everyone, welcome to Pediatrics by Dr. Anand. Such a beautiful day today. Let's start off this class. Which of the following it is seen in tracheoesophageal fistula? Which of the following things is seen in tracheoesophageal fistula? Number one, if I say olive-shaped mass was seen in congenital hypertrophic pyloric stenosis. Scaphoid abdomen, it is seen in congenital diaphragmatic hernia. Whereas drooling of saliva, yes, this finding it is seen in tracheoesophageal fistula. What is the time duration of pre-oxygenation of a child during endotracheal intubation? What is the time duration of pre-oxygenation of a child? Pre-oxygenation, like before you intubate the child, how many times, like for how long should I do the bag and mask ventilation? No, we have to make the saturation proper and then intubate the child. So what is the time duration for pre-oxygenation of a child during endotracheal intubation? Roughly 3 to 5 minutes. Like this option, the best answer is 5 minutes, but usually the book says 3 to 5 minutes is a very ideal time. Like whenever the patient is kind of desaturating, before you intubate, do bag and mask properly, put the baby saturation 99% and then you intubate the child. So time duration for pre-oxygenation for this whole thing takes 3 to 5 minutes. Okay, number one. Number two, what is the temperature of the room to ensure a warm chain in the delivery room? What is the ideal temperature of delivery room? 25 to 28 degrees Celsius. 24 to 28 also is fine. So 25 to 28 degrees Celsius is the best answer. A child on tuberculosis treatment and has a orange color urine. What will you advise to the mother? We have done that question. Orange color urine is okay. There's nothing to worry. It's a normal finding, It is okay to have a orange color urine if the baby is on tuberculosis, on ATT basically, anti-tubercular therapy. According to Holiday formula, or the full name is Holiday and Segar formula, what is the fluid requirement of a 20 kg baby? So we have the formula, 1 to 10 kg, 10 to 20 kg and more than 20 kg. So 1 to 10 kg, the fluid requirement is 100 ml per kg. For 1 to 10 kg baby, the requirement is 100 ml per kg. If the baby has crossed 10 kg, then the requirement is 50 ml per kg, and if the baby is more than 20 kg, the requirement is 20 ml per kg. Means if the baby is 20 kg in this question, I will do 10 plus 10. Why will you do 10 plus 10? Because the beginning 10 kg will be always dedicated to 100 ml per kg. So 1 kg baby, 100 ml fluid is required. 10 kg baby, 10 into 100 is 1000 ml. So 1000 ml fluid is required. Whatever the next 10 kg is left will be always on the behalf of 50 ml per kg. So 1 kg baby, 50 ml fluid is required. So 10 kg baby, 10 into 50 is 500 ml. So the best answer for this question, very importantly, it is 1500 ml is the requirement. A 4-year-old HIV positive child is at risk of contracting tuberculosis. The baby is HIV positive. He can get tuberculosis. Which medicine is given for the prophylaxis? They are asking for the prophylaxis of tuberculosis, not for the prophylaxis of HIV. So the best answer for this question we have is isoniazid. Isoniazid is given if the mother is to prevent tuberculosis. We give isoniazid to the baby. A mother with 3-month infant come to clinic for IPV, inactivated polio vaccination. Nurse should acknowledge the mother about IPV that it is given just only at birth. That is a wrong answer because IPV is given at 6, 10 and 14. Just after birth we give BCG, OPV and hepatitis B. BCG, OPV and hepatitis B is given just after the birth, and IPV it is given at 6 weeks, 10 weeks, 14 weeks. It is more potent than oral polio vaccine? No, it is less potent than oral polio vaccine. It protects from only type 1 and type 3 virus strain. That is a wrong answer because it protects against all the subtypes. Okay. A nurse is caring for her child for cleft lip surgery. What should be used to control to reach the surgical site? Very nice question. Baby should not touch his lips again or something like that. Then we'll do something. I'll show you a very beautiful photo. This very beautiful photo. What restraint is this? This is known as elbow restraint. Okay, elbow restraint. This is the elbow. So elbow restraint is like this restraint where the baby cannot touch his hand to the cleft palate surgery point, and that is nothing but elbow restraint. You can change your life by changing your heart. You can change your life by changing your heart. Your so hope is the biggest thing in life. Hope is really important. You need to be hopeful. Okay, everything will make sense by the end of the journey. And if nothing is making sense, this is not the end of the journey. So sab theek ho jayega. You just need to have faith in yourself. You change your life by changing your heart, by changing your thought. The first dose of vitamin A is given when? The first dose of vitamin A is given at 9 months of life. Then it is given every 6 monthly till 5 years. It is given every 6 monthly till 5 years. A newborn has yellow face on the third day of birth. बच्चा है पीला है third day पे. What is the most appropriate statement of nurse will be? Baby need phototherapy? No, every baby does not need phototherapy. Expose the child to sunlight. Our grandparents do that, but we don't. Books have not written expose the baby to sunlight. No need of any intervention. That is the best answer. Need to take blood investigation? No. If the baby has look very sick looking and all that, then you do the blood investigation. So right now it's a physiological jaundice which needs no treatment. What is the dose of zinc? What is the dose of zinc in a 10-month-old baby? Less than 6 months baby we give 10 mg, and more than 6 months baby we give 20 mg. Which of the following is not a component of the Apgar score? So it is appearance, pulse, grimace, activity and respiration, because respiratory rate is not a part of the Apgar score. A 9-month-old child came with fever from last 2 days. What is the ideal route to check the body temperature? Nice question. Simple ones. Simply at your house, what do? We all check the auxiliary temperature. Auxiliary is nice. Why not oral? Because not recommended because injury, poor compliance, dirty hygiene issues. Axilla is always the best. Okay. Which instrument is used to check the weight of a 7-year-old unconscious child? Yeah, this is the update. So the child is unconscious, so I cannot use the electronic weighing machine because the child has to be alert for that. Stadiometer, this instrument is used to take the height of the baby, not the weight of the baby. Acha, okay, now the best answer for this question will be Broslow tape. Okay, okay, firstly I'll tell you the best answer is Broslow tape. Why? Broslow tape, firstly you'll take the length of the baby. This is a Broslow tape where you're taking the length of the baby. This is a Broslow tape where you're taking the length of the baby. But in the MCQ, the which instrument is used to check the weight of the baby, they are asking. But in this, you're taking the length of the baby. Yes. Why? Because number one, it is a color coding measuring tube used in emergency. Number one, it is a color coding measuring tube. You can see red, orange, green, beautiful colors are there. It's a color coding, for use in emergency. Estimate the weight of the child based on the length and the height. So first you take the length of the baby, and based on the length and the height, you estimate the weight of the baby. So basically we are taking the length only of the baby over here, but by the length I'm indirectly gonna estimate the weight of the baby. So it's an indirect estimate of weight of the baby based on the baby's length. It basically designed for pediatric emergency settings and especially for those babies who are unconscious or cannot stand. Which disorder has a characteristic of visible peristalsis movement? Visible peristalsis is there in congenital hypertrophic pyloric stenosis. Tetralogy of hollow boot-shaped heart, transposition of great arteries, agon side appearance. Which statement among the following is true regarding the inactivated polio vaccine? Same only. It is more potent than OPV? No. It protects from all strains of polio virus? Yes. It protects only from the wild virus? No. It is given at birth? No, it is given at 6, 10 and 14 weeks. What test should be done to diagnose a cystic fibrosis in a child? A mother while kissing her child found her child's skin salty tasting. So basically sweat chloride levels or sweat test, basically if they are more than 60 milliequivalents per liter, that is significant for cystic fibrosis. It's okay to be different. Such a beautiful quote. ज़रूरी नहीं कि जो सब कर रहे हैं वही मुझे करना है. It's not mandatory what everyone is doing I should do that. I can make my own path and live a very beautiful life. When a nurse inserts nasogastric tube for a baby with drooling of saliva, she finds out that the tube is not going down. Tube is not going only. Why tube is not going only? Because obviously the coiling of the nasogastric tube or tube is not going. The best answer is tracheoesophageal fistula, because tetralogy of Fallot doesn't present like this and the patient will have cyanosis and all those problems. Okay. What is the schedule of vitamin A in a patient with white hot spots? This is a good question. If the patient has night blindness or vitamin A deficiency features, then you're gonna give 3 doses today, tomorrow, and day 14. To day 1, day 2, day 14 of vitamin A is given if you have clinical deficiencies features of vitamin A. What should be checked before giving potassium to a child after birth? Nice question. So basically potassium is excreted by the kidneys. Potassium comes out of our body by the kidney. So kidney is something, potassium is excreted through the kidneys. That's why urine is something very important. And hyperkalemia and hypokalemia, definitely later it can cause cardiac anomalies, like ECG should be checked if the patient has hypo or hyperkalemia. But first also is the urine output. Which is the most commonest cause of seizure in a child? In a child, if we talk about it, is febrile seizure. In a newborn, if we talk about, the most commonest cause is hypoxia. Okay, so yeah, that's it. Okay, a nurse while assessing a new UpGuard score at score of 7 at 1 minute. The new nurse, she found that the baby has a UpGuard score 7 at first minute. After birth, notices that the corner of the neonat's mouth is stained with meconium secretions. What should be the next step for this one? Okay, so meconium stained baby is there. Now, very importantly, so the UpGuard score is 7. What is the normal UpGuard score? 7 or more than, basically more than 7 is a normal UpGuard score. This baby also is, the score is touching towards the 7, which is kind of a normal thing. It's the baby is not sick. Prepare for resuscitation. No, it's not. Did the baby's UpGuard is 7. Inform the physician. No, it's okay. He might have a meconium stain, but you don't have to inform. Perform secretion, so suction of mouth and nose, and perform the routine care. So if so very importantly, if the baby is, if the baby is healthy baby, good baby, this baby UpGuard is 7, then the answer would be over here is perform the routine care. Okay. If this baby was a sick baby, if this baby was a non-vigorous baby, what is non-vigorous baby? Heart rate less than 100, that is the non-vigorous baby. If the baby was a non-vigorous baby, then definitely I would have suction the mouth and the nose and followed by bag and mask ventilation. Heart rate less than 100, we always do bag and mask ventilation. So bottom line is this: if it is a vigorous meconium stained baby. What is vigorous in this question? This baby is a vigorous meconium stained baby. Vigorous means heart rate more than 100. Heart rate more than 100 is a vigorous baby. In that baby, you don't have to do anything. Perform the routine care. That's it. So that's why this UpGuard 7 looks okay to me. So this baby looks fine. So routine care. If this baby was a bad UpGuard score, heart rate less than 100, then I would have done the suctioning the mouth and the nose. Yes, coming to the next question. Next question, we have the function of zinc. What is the function of zinc? So very importantly, what is the function of zinc in the management of diarrhea? The function of zinc in the management of diarrhea to resolve the abdominal cramps? No, it's not like that. All of the above to prevent induration. This is not Montauk's text. So his main role of zinc is to increase the appetite. To increase the appetite of the baby, we use basically this. Zinc is is used as one of the important NORCET pre-YQs. A child having diarrhea shows sunken eyeballs and thirsty. Here only if I stop you. Thirsty, and the child is eagerly drinking the bottle of water. So eagerly drinking the bottle of water is some dehydration, and for that we'll give ORS at the rate of 75 ml per kg. Please remember that. According to IMNCA guidelines, what's a danger sign of a sick baby indicate? Danger sign kya hota? So someone having lot of vomiting, because vomiting will lead to dehydration, and the patient can land up into shock. So vomiting is something which is a danger sign for a baby. Yellow color, jaundice, fever, watery eye, that's not a danger sign. A child on chemotherapy, the nurse should teach the mother about the following, except if the mother is on anti-cancer drugs, what she should not advise. She should teach all, except she should teach about hand washing, avoid crowded places, brush your teeth, and maintain your hygiene in your body. Sitz bath is for hemorrhoids, not for this. So sitz bath is something nurse will not teach. A male patient present patient with tall stature, gynecomastia and small testes. Tall stature, gynecomastia and small testes, we're talking about clearly Klinefelter syndrome. If this was a male patient again with the pulmonary stenosis, male patient with a webbed neck, then definitely I would have think of Noonan syndrome. If this was a mitral valve prolapse case, a female patient, I would have think of Marfan syndrome. But this patient is Klinefelter. A mother of a 9-month-old baby is concerned about her child cannot sit without support. Which of the following statement is most appropriate? He cannot sit without support. So sitting with support comes by 6 months, sitting with support comes by 6 months, and sitting without support comes by 8 months. Okay, so 8 months baby should be sitting without support. He cannot sit without support. So what do you think? Definitely the answer is yes, it is delayed. Most baby do sit without support by 6 to 8 months. This is completely normal. That's the wrong answer. This is slightly delayed. Most babies sit unsupportedly by 10 months. No, sitting without support comes by 8 months. This is advanced. No, this is not advanced. So nice answer. A child on CPAP is hemodynamically stable. Which of the following is best method of feeding this child? CPAP is continuous positive airway pressure. CPAP is a machine basically for use for the preterm baby who can't breathe properly. So the thing is, which of the following is best method of feeding for the baby? See, if someone is on CPAP, no, you can start by tube feeding. You can start tube feeding, and if tube feeding goes well, then you can start breastfeeding. So tube feeding is something you'll start the whole story, because the nasal CPAP is usually by the nose. This is like a nasal prongs it is given. So orogastric feeding becomes the best answer. A 5-month-old girl with normal birth history present with the milestones and hand wringing movement and deceleration of the head growth. So hand wringing movement, very simple, very nice. Hand wringing, kahan pada? Where have you read hand wringing movement? So hand wringing movement, very importantly, we have seen in Rett syndrome, and the gene mutation is MECP2. MECP2 gene mutation. We have the latest drug we have, that is trofinetide or trofinetide. So that all is important. And yeah, hand wringing, like this hand wringing movement is a Rett syndrome. Why it is not autistic spectrum disorder? The child is inattentive, impulsive and stereotypical pattern. Inattentive, impulsive and a stereotypical pattern. Repeated same cheez bachcha karta rehta hai. That is autistic baby. Why it is not cerebral palsy? He should have a delayed cry history. This is the normal birth history. Should have a delayed cry history and all. Why it is not Down syndrome? Down syndrome don't have a hand wringing movement and all. A 6-month-old infant is receiving ribavirin for the treatment of respiratory syncytial virus. Ribavirin is given via which of the following routes? Ribavirin, basically number one, this is a case of bronchiolitis. The treatment for bronchiolitis is just only oxygen. If the patient is immunocompromised with bronchiolitis, then we can give ribavirin basically, and it is given as a nebulization. It's a very recent NORCET question. What is the dose of adrenaline in use in neonatal resuscitation? One of the favorite question for all the exams. 0.1 to 0.3 ml per kg in 1:10,000 dilution is the dose of adrenaline in neonatal resuscitation. 0.1 ml means 0.01 mg and 0.3 ml means 0.03 mg per kg. So 0.01 to 0.03 mg per kg in 1:10,000 dilution. That is our best answer. Okay, yeah, this is the best answer. And what do you call, very latest, it is more latest, it is 0.2 ml per kg, the latest drug. They have changed the dose from 0.1 to 0.3. They have given a single dose now, that is 0.2 ml per kg. That's it. That finishes this class. Thank you so much everyone. And before leaving, what is the quote? The way to success. This is the way to success, but you will have mistakes, failure, rejection, frustration, insult, but you are the best, and once you are the best, destiny will do the rest. So best of luck, please take care, and thank you.